Doctors Group slams move to allow employers to require doctor's note for minor illnesses. Canadian Medical Association President Dr. Gigi Osler says the measure could cause public health issues, as it will lead to sick people going to the doctor's office or to work, rather than staying home.
Here's a summary of the article.
A national doctors group is raising concerns about the Ontario government's move to allow employers to require workers to provide a doctor's note to explain even minor illnesses, such as the common cold. Canadian Medical Association President Dr. Gigi Osler says the measure, included in the government's Bill 47, could cause public health issues, as it will lead to sick people going to the doctor's office or to work, rather than staying home. It says the poll, conducted by Ipsos, suggests a majority of working Canadians oppose allowing employers to require sick notes for minor illnesses. The survey also finds that 8 in 10 Ontarians who responded said they would likely come into work when ill if their employer required a sick note. Requiring sick notes can introduce unnecessary public health risks. Patients who would have otherwise stayed home may spread viruses or infection while out to get a sick note, Osler said in a statement issued by the CMA on Friday morning. For physicians, writing a sick note is added administrative work, time that should be spent providing direct care to patients, Osler said in the statement. The previous Liberal government amended the Provincial Employment Standards Act to prohibit employers from requiring a doctor's note for personal emergency leave, which includes personal illness or injury.
This post received a score of 2,891, with an upvote ratio of 97%. Here are the top comments in response to this article.
Easiest way to tell if an employer is insane is reviewing their sick policy. It will almost always be a perfect example of their general behavior.
I once showed up to work with not one but 2 hospital bracelets on and was promptly asked for a doctor's note. My boss was a cunt.
Doctors don't want you coming in with a cold and spreading it through the waiting room, and wasting time with what is obvious. But what choice do I have? I have a bad cold and need written proof of it or risk termination.
Primary care doctor visits are also fully taxpayer-funded in Canada, zero out-of-pocket payment, so it is also a stupendous waste of government money.
This has been a common practice in Asia for years. I told my staff in Shanghai if they were really sick, to simply stay the fuck home rather than coming in and infecting more people. They appreciated my policy and it wasn't abused, because they were intelligent adults who knew they still had a job to do when they got back. I absolutely hate these policies that don't respect the workers as adults. Sure, there are people who will abuse their sick day allowance, but if you want to encourage employees to be team players, you have to give them the benefit of the doubt.
I think it is a case of weak managers who can't face the troublemakers and properly resolve the issues. They make these blanket policies out of laziness.
This is exactly what it is. Easier to shrug and, well, that's policy, than have us sit down and confront an employee abusing the system.
Haha, that's funny because in my 3rd year of med school you couldn't get an excused absence for illness unless you could bring documentation to show you had been in the ER. Apparently anything less shows it wasn't that serious enough to be absent from rotations.
I've had friends in medical school. Their workloads were obscene. Tell me, why is it that doctors are worked to death?
Because we are at the mercy of sociopath MBAs and politicians controlling healthcare just like the rest of you.
If I have to get up, get dressed and drive somewhere, I might as well just go work and save the copay. Especially when you know what it is that's going around and they're just going to tell you to rest and stay hydrated. This is in Ontario, so there is no copay. But I agree with the sentiment, as going to a doctor can be a hassle, including time lost and maybe cost of gas, parking.
But they do charge for the notes. I got one a couple of months ago and it was $20.
Yep, $40 at my clinic.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.